Right, now we're looking at Christian attitudes towards euthanasia. The word euthanasia comes from two Greek words, eu, meaning good, and thanatos, meaning death. So it literally means a good death. There are different Christian attitudes and beliefs on what constitutes a good death, and whether or not the quality of life is actually more important than the sanctity of life, as we're about to discover. There are different types of euthanasia. Voluntary euthanasia is when someone asks for the end of his or her own life but is unable to commit suicide without help. It's often called assisted suicide. Involuntary euthanasia is when other people decide that it would be best if somebody's life ends because he or she is not able to make that decision independently, such as somebody who is in a persistent vegetative state. Active euthanasia is where action is taken to bring life to an end. For example, a lethal dose of drugs might be given. This is actually against the law. And passive euthanasia, when a decision is made to stop giving further treatment, such as antibiotics or invasive painful surgery, even though death will be the result. The Roman Catholic Church is totally opposed to euthanasia and teaches that any act which deliberately brings about the death is the same as murder. It teaches that ordinary treatments, such as feeding a patient, must always be continued, but that extraordinary treatments, such as complicated operations that are unlikely to succeed, need not be given. They do this by applying the doctrine of double effect, which we've mentioned on some previous videos. The Anglican Church has a very similar view to that of the Roman Catholic Church, and it teaches that although the deliberate taking of human life is forbidden, there are strong arguments that people should not be kept alive at all costs when they are suffering intolerable pain. To allow someone to die might actually be the most loving thing to do, and applies the Christian principle of agape. The Quakers don't have a united view on euthanasia. For Quakers, what is most important is that they do the most loving thing. Many Christians support the hospice movement. Hospice is care for the dying. They do everything they can do possible to make a patient more comfortable, such as keeping severe pain under control. It's what we call palliative care. They give the dying patient a peaceful and happy end to life, and they provide an alternative to euthanasia, believing that a good death can actually be achieved without killing them, if a patient is particularly surrounded by love, care and support. The quality of life versus sanctity of life is a big question. Many Christians and non-believers would consider the quality of life of the patient. Christians in particular want to compare this with the teachings about the sanctity of life. Should a patient be forced to live even though they're in desperate pain which cannot be relieved? So, some key words. Euthanasia means a gentle or easy death, or helping somebody to die. A hospice is a place where terminally ill patients are cared for, and palliative care is a name given to the care of a terminally ill patient to help them die as much comfort as possible. One of the key persons in relation to hospices and palliative care is Dame Cicely Saunders, who lived from 1918 to 2005, and she founded the first modern hospice, which is St Christopher's in London in 1967. Something to remember. Euthanasia is obviously related to suicide, because it's about people choosing how and when a life should end, either their own life or that of somebody else. Sorry, just lost track. The difference between suicide and euthanasia is that euthanasia involves more than one person.